Let's study the pattern of the abdominal exam as we go from one organ to another. We will concentrate on developing skills of the transducer hand. Use your canine abdominal graphic to copy my movements. Look at your transducer hand as we do the scan. Your brain will make a mental motion picture of your movements to help guide your hand in the future when you are looking at the ultrasound screen instead of your transducer hand. Pay particular attention to the tempo of transducer movements and the position of the transducer in relation to the patient's body or graphic. I will allow time for you to watch my movements and then copy them. I choose to begin the abdominal scan with the gallbladder and liver. Elevation of liver chemistries is one of the most common reasons for an abdominal ultrasound. The gallbladder is normally an anechoic, balloon-shaped structure surrounded by liver and usually easy to find. Some normal cats have a bilobed gallbladder, as shown here. It is not important where you may choose to begin the abdominal scan. It is important that you develop a habit of systematically examining each organ of the abdomen. The normal gallbladder is usually a balloon-shaped anechoic organ in the cranial abdomen, a little to the patient's right side of the ventral midline. Place the transducer in a sagittal position at the patient's right side of the xiphoid on the abdominal graphic and angle cranially. Anchor your transducer hand to the abdominal graphic. Fan the transducer slowly to the patient's right side till the transducer is pointing toward the gallbladder. Continue to fan to the patient's right till the transducer is no longer pointing at the gallbladder. Then reverse direction and fan to the patient's left through the gallbladder. Fan the transducer back to the middle point of the gallbladder. While pointing at the gallbladder, rotate the transducer 90 degrees counterclockwise to a transverse position. Do not change the angle of the transducer while rotating. Fan the transducer cranially as far as you can. Then reverse and fan caudally till the transducer is no longer pointing at the gallbladder. Return to the middle point of the gallbladder and rotate 90 degrees clockwise back to a sagittal position. Do not change the angle of the transducer while you are rotating. The liver is a homogeneous, rough-textured tissue caudal to the diaphragm. Now we will examine the liver. The normal liver does not usually extend beyond the last rib. That is why we must angle cranially to see the liver. Having examined the gallbladder, we are already in position to continue with the liver. Fan or slide the transducer along the last rib to the patient's right side till all of the right liver has been seen. Then reverse directions and fan or slide slowly to the patient's left till all of the left liver has been seen. Return the transducer to the patient's left side of the xiphoid. Rotate the transducer 90 degrees counterclockwise to a transverse position. Do not change the angle of the transducer as you rotate. Fan the transducer cranially as far as possible. Then reverse directions to fan caudally till all of the liver has been seen. Return to the middle point of the liver and rotate the transducer back to a sagittal position. Do not change the angle of the transducer as you rotate. The stomach is caudal to the liver. It is a hollow organ with 4 wall layers. The cranial wall of the stomach is usually in contact with the caudal wall of the liver and is seen while examining the liver. Angle the transducer caudally till it is perpendicular to the graphic. Center the stomach beneath the transducer for a wall measurement. After the wall measurement, slide the transducer caudally to center the caudal wall of the stomach under the transducer. The ultrasound beam will usually overlap the caudal wall of the stomach and the transverse colon. The left limb of the pancreas is between the caudal wall of the stomach and the transverse colon, so it will also be on the ultrasound screen. Slide the transducer to the patient's right side till the stomach is no longer under the transducer. Reverse directions and slide to the patient's left side till the stomach is no longer under the transducer. The spleen is a finely textured, homogeneous tissue originating from the left cranial abdomen. We proceed next to the spleen. The head of the spleen is attached to the left lateral wall of the stomach, cranial to the last rib. Use the little finger of the transducer hand to feel for the last rib on the patient's left lateral side. Place the transducer in an off-sagittal position on the left lateral side and cranial to the last rib. The transducer is off-sagittal to look between the ribs. Slide the transducer cranially till the spleen is no longer under the transducer. Then slide caudally and follow the spleen wherever it goes in the abdomen. Keep the transducer perpendicular to the patient's body as you follow the spleen. In dogs, the spleen is often large, and all of a short axis view does not fit on the ultrasound screen. Keep the leading edge of the spleen centered under the transducer as you follow toward the tail of the spleen. At the tail of the spleen, reverse directions and keep the caudal edge of the spleen centered under the transducer as you follow back toward the head of the spleen. In cats, the spleen is usually small and can be seen in a single pass. Kidneys are encapsulated organs with 2 primary densities, a homogeneous cortex and a hypoechoic medulla. When we finish with the spleen, the transducer is in an off-sagittal position on the left lateral abdomen and cranial to the last rib. In dogs and cats, the left kidney is usually caudal to the last rib. Rotate the transducer to a left lateral sagittal position and slide caudal to the last rib. To bisect the kidney, the transducer should be perpendicular to the patient's body and parallel to the tabletop or the floor. My abdominal graphic does not simulate this position well, so I will compensate to obtain the proper transducer position. Slide the transducer slightly dorsally or ventrally to center the kidney under the transducer. Fan the transducer ventrally till the transducer is no longer pointing at the kidney. Then reverse direction and fan dorsally till the transducer is no longer pointing at the kidney. Return to the initial position bisecting the kidney. Rotate the transducer 90 degrees counterclockwise to a transverse position. Fan cranially and then caudally till all kidney tissue has been seen. Rotate the transducer 90 degrees clockwise back to a left lateral sagittal position over the left kidney. The left adrenal is a small, peanut-shaped nodule near the cranial pole of the left kidney. The left adrenal is usually near the cranial pole of the left kidney, so slide the transducer to the cranial pole of the left kidney in a left lateral sagittal position. Remember to keep the transducer perpendicular to the patient's body. Fan the transducer very slowly, ventrally or dorsally till the aorta and the left adrenal are seen. The urinary bladder is a balloon-shaped anechoic organ in the caudal abdomen. From the left adrenal, we will move to the urinary bladder. We will accomplish this by moving in a zigzag pattern from the left lateral sagittal position to the ventral midline sagittal position and back again. As we zigzag, we will move slowly caudally toward the urinary bladder, reaching it in about 3 passes. The purpose of the zigzag pattern is to examine the left caudal quadrant of the abdomen for effusions or any lesions of the intestines or mesenteric lymph nodes. Once we reach the urinary bladder, center the bladder under the transducer in a ventral midline sagittal position. Fan the transducer to the patient's right side till the transducer is no longer pointing at the urinary bladder. Then reverse directions and fan to the patient's left side till the transducer is no longer pointing at the urinary bladder. Return to the ventral midline sagittal bladder and rotate the transducer 90 degrees counterclockwise to a transverse position. Slide rapidly cranially till the bladder is no longer under the transducer. Then slide slowly caudally till the caudal bladder is no longer under the transducer. Study the urinary bladder as you slide caudally. At the caudal bladder, rotate the transducer 90 degrees clockwise back to a ventral midline sagittal position. The prostate is a circular to oval, homogeneous tissue caudal to the urinary bladder and surrounding the urethra. In a male dog, slide the transducer caudally to follow the urethra into the prostate. Center the transducer over the prostate. Fan the transducer to the patient's right side, then reverse and fan to the patient's left side till you have seen all of the prostate tissue. Rotate the transducer 90 degrees counterclockwise to a transverse position. Fan the transducer cranially and then caudally till you have seen all prostate tissue. Rotate the transducer back to a sagittal position. From the urinary bladder and prostate, we will move the transducer to the right kidney. We will accomplish this by moving in a zigzag pattern from the ventral midline sagittal position to the right lateral sagittal position and back again. We will move slowly cranially as we move toward the right kidney in about 3 passes. The purpose of the zigzag pattern is to examine the right caudal quadrant of the abdomen for effusions or any lesions of the intestines, mesenteric lymph nodes, or right limb of the pancreas. The transducer will be passing over the ascending colon and descending duodenum. The right limb of the pancreas is located between these structures. Kidneys are encapsulated organs with 2 primary densities, a homogeneous cortex and a hypoechoic medulla. Once you reach the right kidney, go to a right lateral sagittal position to bisect the kidney. If you have trouble finding the right kidney, in cats, feel for the last rib on the right lateral side and place the transducer caudal to the rib and perpendicular to the patient's body. In most dogs, the right kidney is cranial to the last rib, so you feel on the right lateral side for the last rib and place the transducer cranial to it and perpendicular to the patient's body. You will be looking between the ribs, and rib shadows may partially block your view. To bisect the kidney, you may need to slide the transducer ventrally or dorsally till the transducer is centered over the kidney. The transducer should be perpendicular to the patient's body and parallel to the tabletop or floor. When you have bisected the right kidney, fan the transducer ventrally till the transducer no longer points to the kidney. Then reverse directions and fan dorsally till the transducer no longer points at the kidney. Return to a perpendicular position. Rotate the transducer 90 degrees counterclockwise to a transverse position and fan cranially till the transducer no longer points at the kidney. Then reverse directions and fan caudally till the transducer no longer points at the kidney. Rotate the transducer 90 degrees clockwise back to a right lateral sagittal position. The right adrenal appears as a small, wedge-shaped nodule near the cranial pole of the right kidney. Slide the transducer to the cranial pole of the right kidney. Fan the transducer very slowly ventrally or dorsally till the caudal vena cava and right adrenal appear. This is the pattern of the abdominal exam that we will follow. During an actual abdominal scan, we will be using the transducer hand to move the ultrasound beam through the patient's abdomen. We will also be using the keyboard hand to adjust the qualities of the ultrasound beam, such as depth, frequency, gain, and focal points. We will use the keyboard hand to make measurements, label organs, and save images to the patient record or archive. There are a few differences between canine and feline anatomy. On the feline abdominal graphic, you see that the stomach does not extend as far to the patient's right as in the dog. The normal, empty feline stomach usually ends near the ventral midline. The transverse duodenum is relatively longer than in the dog. Unlike a dog's spleen, which can vary greatly in size, the normal spleen in a cat should always be small. Both kidneys are usually caudal to the last ribs. In cats, the normal ileum is recognizable and quite different from other intestines. The ileum is often seen in the right caudal quadrant of the abdomen and can be followed into the ascending colon. Now let's go through the abdomen one organ at a time.